is a public meeting, so I'm just making you aware of that because the recording has just started. So we are in effect now, available for viewing after we've had this meeting. So can I take the opportunity now as chair of the trust to particularly warm welcome to our new governors who have joined us formally today, many of whom were with us at an induction event that we had in May, but really pleased that so many of you have been able to join this first full council meeting today. And of course, welcome back to our re-elected governors and also governors who continued in relation to the term that they were already serving. Given, albeit some of us had the pleasure of meeting our new governors through the induction event, I'm going to just suggest that if you are coming in to perhaps present or answer a question or even ask a question, it'd be great if you just take the opportunity to say who you are, what your role is, if you're a governor, what seat you cover, for example. And then that way, because there's quite a lot of people, and if we try and introduce everybody at the start of the meeting, I suspect we'll be here for 10 or 15 minutes, but it'd be great if you take the opportunity to say who you are, as I say, when we're going through our business, and then hopefully everyone will be able to identify each other. Also, actually, helpfully, I think for most people, we can see your name on screen anyway. So hopefully you can work out who everybody is, but it'd be great if we take that opportunity. And a reminder really that we are in the pre-election period, and for that reason we just need to be mindful that we don't say or do anything that would influence the election, and that's just an obligation that we share along with our colleagues in local government and elsewhere to make sure that we're sensitive to that during this period. Huge welcome to everybody. Just note the apologies that we have received for this meeting. So we've had apologies from Carol Phillips, who is one of our patient and carer governors. We've had apologies from Sue Watts, who's our partner governor for Age, representing Age UK. We also have apologies from Rupal Shah, who is a public governor, and Matt Golby, who's a partner governor. That's the formal apologies that we have received today, but I think we have plenty of governors to be quorate, I hope. I'm hoping for a nod. Joe has confirmed that, so that's a really good start, so thank you very much. So on to item 2 of our agenda. It is basically declarations of interest. So just to say, really, just a reminder to everybody that if there are any particular areas where you have a potential conflict of interest, that or you have a role in an organization and we're talking about a topic that maybe is linked to that organization, it's always worth making clear that you are an employee of a different organization or something, or you have a role that might be relevant. So I will just ask you to do that. But also, if you do have a list of interests that you want to declare, you just need to let the office know so that they can record that on the register of interest, which we're all required to do as directors and governors. So that's just a reminder, and one that I'll usually remind you at every meeting. What I will say is that as part of actually the learning we had from governors who stepped down previously, who decided to step down, one of the pieces of feedback we had was to sort of keep the amount of formal papers to a minimum. And so for this meeting, we have chosen to do a lot more, although we still need to keep introducing some papers to you, we have tried to limit those to things that we really need to cover with you. So I'm really hoping that will be helpful for people. But we do encourage you, if you want to find out anything about any of the documents that we've shared with you, please do feel free to ask a question if you'd like to. And if we can't answer it in the meeting, then we will take that away. But one of the formal papers I'm always required to ask you to approve is the minutes of every meeting, because it is a formal record of our meeting. And so paper B, which I just need to ask you to approve, it's minutes of the previous meeting. So I'll just ask those of you particularly who were here for the last meeting, which was back in March, on March the 14th, to just confirm if there are any issues with the minutes that have been shared with you. If not, I'll take it that you're happy to approve that they are accurate. I have obviously been through them as chair, and indeed so has Richard's team. So we'll take it that everyone's satisfied that they are an accurate set of minutes. So in terms of the action log and matters arising, there are no actions outstanding. So we've not circulated a log today, and that's just for noting. So in line with our usual practice, which I know many colleagues will be new to, the first session of the council is what we call constitutional matters. So it's an opportunity really for Richard and Richard's team to talk about things that are relevant to your role as a governor. And so the first item number 5, is the Council of Governors report. And so I'm going to hand over now to Richard Smith, and I'll let Richard introduce himself, but also cover that report for us. So over to you, Richard.
Thanks very much, Christian. Good afternoon, everybody. My name's Richard. I'm the Director of Corporate Governance, and a particular thanks to members of the governance team that have helped me to pull together the slide pack, which is paper C in the reports. So I wanted to draw out 7 of the areas in the report for a bit of a discussion this afternoon. But before I do so, I just wanted to warmly welcome, as Christian did earlier, governors that either continue with us from last year or have joined us following the elections process that we concluded at the end of the last financial year. And we have had a short hiatus actually since our last meeting in March, in part because of the elections process, but particularly because we decided last year to move our meeting cycle of the Council of Governors to slot in the month after the board meetings as an improvement in the way that the governors can hold the board to account, hence there being a short gap since last time round. So as I say, I do want to extend a warm welcome to those that have joined us, and perhaps we'll just ask Tracy to share with us who's actually joined and what their roles are, please, Tracy.
Richard, just before I start, did you want me to share the slides, or are you happy for me not to share them?
I think if everybody's got them, let's not share them, but thank you.
Yeah, that's fine. So we welcome, I believe it's 11 new governors. So we've got 2 new governors in Daventry South Northants, which is Adam Webb and Marcella Day. We've got 2 new governors in Public Northampton, which is Pete Spink and John Wishart. Michael Fanning joins us for the Public Rest of England. Then we've got a new patient carer governor in Damon Bohan. Carol Phillips is re-elected, but this time as a patient and carer governor. So Carol has been successfully re-elected in a different constituency this time. And we've got our 5 staff governors, one of which is re-elected, which is Richard Amponza. And then we've got Mike Broodham, new Gunasekha, Sheila Begley, Heba Kadir, and we've also got one new partner governor, which is Claire Clinker, who was taken over from Roshni, who you remember has stepped down from her role.
Thanks very much, Tracy. As I say, a warm welcome to colleagues that have joined us, and congratulations on the elections process, which this year did attract record competition, I think, for us over the recent years, which was particularly pleasing, perhaps not for those involved in the competition, as I can imagine that could be slightly stressful, but certainly from our perspective in generating a reasonable level of interest in governor positions, which was one of the objectives of this year's elections campaign. So congratulations to those that have been successful. So you'll see from the report, and indeed as Christian has mentioned, that we had a recent face-to-face induction session. Again, this was part of some feedback that we had before in helping governors to really build connections and relationships together. So it was good to meet in person at St Mary's Hospital, and you can see a great photograph. Actually, there are a couple of photographs in the report of the event. Through this event, and indeed an ongoing programme of development work that we've got in plan for the council, we will seek to equip governors with the knowledge and skills that they need to undertake their role. And as Christian alluded to earlier, we're really receptive to feedback. So if there's anything that's missing or anything in particular that as governors you would like us to factor in, please do let us know. We'll do our best to accommodate that in the plan over the coming year. So secondly, on the theme, I guess, of elections, we do now need to launch the elections process for a lead governor. So I particularly wanted to thank Richard Ampozzo, who I think I saw on the screen earlier, who's done a grand job as our interim lead governor for a period of time. We said once we'd concluded the annual elections process for the last year that we would then seek to appoint a substantive lead governor from amongst the council. So we'll be launching this process using our standard procedure following the Council of Governors meeting. And it's worth saying, actually, that whilst we've got a position called a lead governor, that's not to say that the person that fulfills the lead governor role has any greater status than any other governor on the Council of Governors. It's really a national requirement to have a contact point for NHS England should normal channels of communication not be available for one reason or another. So, as I say, we'll be publishing some more information out to governors and seeking nominations for lead governor, and indeed subsequent to that, deputy lead governor over the next few weeks. The third area then I wanted to draw out of the report is two of the groups that we've got in place that are supporting the work of the Council of Governors. So you'll see from the fifth slide that we've got information on the Nominations and Remuneration Committee, which we often abbreviate to NOMREM, which is in situ really as a formal part of our governance structure for governors to appoint and appraise or consider the appraisals of non-executive directors of the board. So I think it's fair to say that the Nominations and Remuneration Committee have been particularly busy because at this time of the year we are considering the annual appraisals of both Christian and non-exec colleagues. So there'll be some more information on this in our subsequent meeting in private session later on. Yes, I dare say members of the Nominations and Remuneration Committee will come in and contribute to that item. So the other key group that we've got in situ for the council is the Membership Engagement and Representation Committee. This is the group that essentially drives the membership work of the council, and is really quite a lively group, at least from the meetings that I've been able to attend. We've been setting priorities then for the financial year 24-25 and considered then some of the improvements we want to make to meetings that we hold between non-exec directors and governors in our local areas, so in the West Northants and the North Northants areas. So you see also from the slide pack that we do have a few vacancies on these groups. So if you're sitting there thinking, I'd quite like to get more involved, then do drop us a line and we'll send you some more information and how to stand. Let's bring Tracy in. Tracy. Well, you're on mute, Tracy.
I'm on mute. Sorry, failed that test straight away, didn't I? But we did have vacancies, but as of today, I believe we have filled them. So I just thought I would make that clear because enough governors have now come forward. So we filled both the non-rem vacancy and we have 2 governors who have come forward for the standards group. And all 3 of them are new governors. So that will be interesting to get some new governors involved in our groups going forwards.
That's great. Thanks very much, Tracy. And thanks indeed to those that have stood and sorry to those that have narrowly missed out then on an opportunity to get involved. Having said that, certainly with the membership group, this is an open access group. So for the membership group, we would welcome more people to join. But for the nominations committee in particular, that does have a closed membership. And although I've talked about the nominations committee and the membership group, I didn't talk about the governor standards group, which is referenced on slide number 6. This is I think I can still say a relatively new venture for us. It was a constitutional change that we made in the last financial year, bringing together a group of governors to oversee the conduct of governors on the council. So again, another important group within our governance infrastructure. So moving through then, not wishing to eat into too much of the time for today's meeting. The other thing I wanted to confirm is that we have completed the fit and proper person test, which is a national requirement. This is something that stems from well, the law, but also CQC regulations. NHS England made a substantive change to the guidance surrounding the fit and proper person test, adding some of the learning that came out of what was called the CARC review. So we've had some additional requirements to adhere to this time around. As I mentioned, we have completed the test for all board members, and we'll be reporting to NHS England at the end of June that we are fully compliant. So that is good news, and we will maintain fit and proper person checks as and when there are changes on the board throughout the year. So the fifth area then was just to highlight some of the work that's been happening in the membership arena of the council. You'll see from the reports that we have been holding regular webinars, but also I particularly wanted to draw out the pledge programme and some national recognition that we've received. So the pledge programme was again something that we introduced to get governors more engaged in some of the work of the council, and equally provide a mechanism so that members could see how their governors were delivering on their statutory duties. I think we ourselves felt that we'd had some success with that last year based on the achievements that governors were reporting, and it's great to see that the national team have also recognised the efforts that we collectively have made, as we've been invited to present to the Governor Conference in July on some of our work to share the learning that we've collected with other trusts across the country. So thanks very much both to governors that have been involved in delivering on pledges, but also to colleagues within the corporate governance team that have facilitated that process last year. As is probably obvious, we do intend to continue the pledge programme this year, so we will shortly be inviting governors to make their own pledges for this year, which we'll bring back to the council at a subsequent meeting. So the penultimate item I wanted to draw out was some of our continued efforts within system working. So people that have been involved in the council last year will be familiar with the work that we've been doing in partnership with Kettering General Hospital NHS Foundation Trust, otherwise known as KGH. We've been developing together with the KGH Council with some interactive webinar sessions on key system topics. This time around, earlier this month, KGH had the opportunity for some of our NHFT governors to join them at a session actually at KGH to get to know each other and to understand any commonalities in terms of constituency activities. I'll perhaps just pause there in case there was anybody that attended that event on the 6th of June that wished to share any of the reflections that they took from that meeting. Don't feel obliged to speak, but if you did want to share something, please do raise a hand or put something in the chat. So just pause there for a moment. Okay, nobody's stepping forward just at the moment. Ah, Sheila.
Hello, Sheila Begley. I'm staff governor. Yeah, it was a very interesting session. It was very nice to meet other governors and actually get a perspective from governors that are outside of our organisation. We did some group work looking at some of the key challenges, and much of that was around communication. And I thought it was very interesting that that they share very much the same issues and potentially solutions, you know, in their organisation as well. So we did ask that any notes coming out of that meeting should be sent to Tracy and then perhaps circulated to the group.
That's great. Thanks very much, Sheila. I'm pleased it was a useful session. We can certainly get the notes shared amongst the council, and indeed we'll be advertising the next of the joint engagement sessions, I think, over the coming months. So yes, thanks very much, and look out for information on our future events. So finally, I just wanted to highlight some of the future events that we've listed in the report, and in particular, because it's topical, the annual public and members meeting, the annual general meeting of the Council of Governors, which will be taking place as usual in September this year, this time on the 23rd of September at 5:30 in the evening via Microsoft Teams. This is a really important annual celebration event, and also an opportunity for both council members and members of the public to receive the annual reports and accounts of the Trust, which looks back on some of the achievements and challenges that we've tackled over the last financial year, but also then looks forward in setting out some of our plans for the coming year. So there'll be lots more advertising that will be coming out for this event, but do hold this date in your diary. And indeed, if you do want to get involved in planning this event, we'll be coming out for some volunteers for that over the next few weeks. So I think with that, Christy, I'll hand back to you for any questions or comments on the report. Actually, what I should just say is, because this is a new look report, we're equally looking for some feedback from you. So either in the chat or perhaps via email, you could let us know if this report is meeting your needs. Thanks very much.
Thank you very much, Richard. So are there any questions or comments about anything that Richard has covered as far as his report is concerned? That there are things that obviously we'll come back to, like I think Tracy's going to be talking a bit more about the membership activity. Michael, please. Hi, Michael. I saw your hand come. Oh, there you are. I can see you now, but we can't hear you, Michael.
Yeah, sorry.
Yes,
hi, everybody. Michael Fanning, Governor for Public Rest of England. It was just really to say thank you so much for the induction day, and it was really informative, and everybody was very welcoming. So I just thought it was a really good start. I know these things take a lot of planning and coordination, but as a new governor, I was very impressed, and I just wanted to say thank you.
Michael, thank you very much. That's really kind of you. Yes, I think colleagues do, as you recognise rightly, colleagues do tend to, try and put a lot of effort into trying to get these things right, and listening to feedback from before. And actually, it was great that we were able to do it. I think we'd done it face to face because actually we felt it was really important that we had the chance to interact. And it was great that I know many of our NED colleagues are also attending here today, as well as Richard's team, were able to be there. So hopefully it's a good start. But I think one of the things that we said to new governors in particular was, we always recognise it's quite a learning curve to get to know the organisation. I know staff governors, will have worked with the organisation for a while, but still getting to grips with what does being a governor mean. So anything we can do to support you. That was the start of a 10, if you like, the induction event, and things like the workshop that we did just a little bit earlier in the day are all intended really to help you get up the learning curve. But anything any queries you have are always welcome, but really appreciate the feedback. Thank you, Michael. Okay, so if there's nothing else, and I think, Richard, you didn't want us to actually particularly approve anything today. That was just an update from you. So if we move on then to item 6, which is what we call the MERC report, which is the Membership and Representation Committee report. I think, Tracy, you're going to cover some highlights.
Yes, Ranjit actually chaired the meeting very well. He is joining us. He's just joining us slightly late. So when Ranjit joins, hopefully I might be able to invite him in if he joins back in time. But it was actually our first meeting with the new governors. It actually jumped this meeting because of that. It happened to be in the calendar first. So a week after induction, we did rather throw our new governors sort of into it with our membership meeting. And we had quite a few join, and it was very well attended and engaged. I'm sure you would agree with that because you were there as well, weren't you? So one of the first things we talked about was our membership and engagement and representation priorities for the coming year and the action plan that went with it. So we'd previously agreed that we would carry forward the improved representation and engagement with children and young people, to improve representation and engagement related to equality, diversity, inclusion, and to sort of engage and have activities related to the Trust's DigBQ strategy as well. So they were the three that we carry forward. So we did present an action plan back to the council, which was related specific to those activities. So some of them were a bit more overarching, the actions we had, for example, reviewing our membership materials. So that was one of the, for an example of one of the actions on the action plan. So it was like the action plan was supported through that meeting, had quite a big discussion about it. But we did have some specific actions that came out of the meeting, and that included finding a bit more information to particularly, I think, newer governors on the membership numbers and where we may need to target more on children and young people and equality, diversity, inclusion. So we said we'd bring that back to the next meeting. We had also previously done a socioeconomic report, which we said we'd reshare so people could see that data as well. We said we wanted to narrow down some specific areas that we should focus on with children, young people and equality and diversity and inclusion, which actually, as we'll come on to in a minute, hopefully do through our constituency meetings. And we also have asked governors to commit to areas that can help support the action plan. And this actually links back to the pledges, because we're actually merging this into the pledges email that will go out early next week. So we were also asking governors where they might be able to support some of these actions and specific areas that you might want to help us get involved in. So the action plan was supported, and we'll hopefully take that forward throughout the year. We also then talked about our NED and Governor constituency meetings that we hold throughout the year, where we have 3 planned throughout the year, and then we have 1 each in West and Northants across those 3 meetings. What we thought would be a good idea this year is to essentially link these constituency meetings back to the membership priorities. And what we've agreed through the membership meeting is that each of those constituency meetings will lead on the 2 key areas of children and young people and equality, diversity, inclusion. So we're just working on booking in speakers for the July meetings. And we'd also ask governors to confirm their attendance. And I can confirm we have had governors confirm attendance for the July sessions. So thank you if you have submitted your availability. The form is still open if you haven't yet submitted your availability, just so we know who's coming to those meetings. And then just to confirm, those 2 meetings for the Northants is on the 18th of July and West Northants is the 31st of July. We also had quite an initial discussion on the post the elections. We had 5 vacancies in the patient and carer constituency. So we started discussing some options and what we might want to do with those vacancies, which was quite a discussion. Summary of that discussion was that we'd come back to the next meeting with a bit more information, because I think particularly as we had lots of new governors, we just needed a bit longer to reflect on what we wanted to do with those vacancies. And so they will remain vacant until such time we make a decision on where we want to take those vacancies. And then the final thing we did at the meeting was review the terms of reference. Now, these had only just been agreed really last year, so it was essentially very minor changes suggested, and they are attached, I believe, as paper E. So we made some minor changes just to job titles. We added a reference to peer support, and then we did agree that we should review the terms of reference every 2 years instead of annually. So they are just there for approving. But that's the key areas we discussed at the meeting. So I don't know whether Judith wants to come in as the NED to say how she found the meeting, or any of the governors who attended now want to come in and say how they found that meeting, because we did get some good feedback at the end. So it would be good for governors to hear that in public as well.
Yeah, thanks, Tracy. I think a really fantastic summary. I don't have anything to add to your summary, except I really felt quite energized by that meeting. A lot of really pertinent discussions, so enjoyed it. Thanks very much for having me there.
Thanks, Judith. So did any governor who attended it want to comment at all? You are most welcome. Unfortunately, I think Ranjit is not yet with us, if I'm right, Tracy, and he chaired the meeting, I believe. Anu, I can see your hand up. There you are. I can see you at the bottom of my screen. People move around. Do you want to come in, Anu?
Yes, I would really like to thank you for that meeting. For me, it's everything new, and it was a very, very informative meeting, and I learned quite a lot, and I'm still like, I have to go through it again and again, like to put it in my head, because in my head, so it's very interesting. I always think me like being staff in here, and then now kind of looking from up seeing what's happening, which is really, that's how I can see, and it's just really, really good. And I want to thank you for Krishni and everybody who's Richard and everybody, Tracy, yeah, all of them been really, really brilliant in making it happen. So it's really good.
Thank you, Anu. Thank you. I'm really glad. I know it's obviously, it's, as we said, a big learning curve for everybody. It doesn't matter what your role is, but you know, either getting to know the organisation or getting to know what being a governor is. But really glad that people have enjoyed the opportunities they've had to interact. And they found it useful. So I can see that that there are a couple of comments. So just wanted to make sure we don't miss these comments in the chat. Mike mentioned, I think, attending the session with KGH. I think that's what Mike was probably referring to earlier. Is that right, Mike? And you shared Sheila's view that it was interesting to hear the common areas to explore around things like communication, which you both referenced. And then Michael, you've mentioned something about system working and collaboration. Did you want to come in on that, or should I bring you in?
Yeah, great, thank you. It's just a general observation, and I didn't want to lose it later in the agenda. So reading the paper E, in terms of the terms of reference, there are at the bottom of the page, there are the references to other documents. So I read with interest the document, the Addendum for System Working and Collaboration. And whilst I acknowledged that the document highlights there isn't a significant change for the role of the council and governors, I just wondered at some point if we could revisit that and have a conversation about it. I'm really picking up the aspects around challenge for the NEDs in relation to, it's really relating to the development of the integrated care systems. And personally, I just think it would be helpful to have a discussion about that. I'm not suggesting we do it today, but I think that's quite a significant document that we should really understand as governors.
Yeah, thank you, Michael. So just, I think if I'm right, you're referring to the official NHS England government that document that relates to the Code of Governance, that's part of or linked to the Code of Governance and the change that came in. And it's a really good suggestion, I think, Michael. And we can perhaps think, I don't know, Richard, if you want to comment on this, but I wonder whether it might be a topic for one of our workshops or something where we could sort of unpack what's in there, because I think it would be interesting to reflect on that, because that was quite an important change that came in relation to the governor role. Richard?
Thanks, Krishni. Yeah, I agree. It would be certainly a useful discussion opportunity, either at a workshop or indeed perhaps through the meetings with KGH, of course, because it would be of interest to KGH governors too. And this is an addendum, as Michael mentioned, to the Your Statutory Duties guidance for governors, which I think Adam had put in the chat was originally published, the core document that is, in 2013 by Monitor, and has subsequently been updated in line with the new Health and Social Care Act 2022. So yeah, we can certainly factor in some time in either a workshop or a joint session with KGH to have the sort of conversation, Michael, that you were referencing. We'll take that away.
Yeah, great. It's a really good idea, Richard, I think, to think about doing that with KGH colleagues, because I'm sure, well, it applies to all of us, doesn't it? So it's a really good opportunity to do that. So thank you, Michael, for prompting that. Notwithstanding that, is everybody happy? Are governors happy to just support the minor changes to the terms of reference, which were obviously considered at that meeting. So I can see sort of nodding. So can I just check if anyone's got any concerns about approving it? If not, I'll just take that as okay, because obviously quite a few governors were part of that discussion. Is that okay with everyone? So we'll approve those terms of reference, but as Michael's already suggested, we will follow up with a discussion around that system working, collaboration, and the role of governors in that as an action to take forward. Thank you. Let's make sure that there was nothing else from the comments. I think we've picked up any questions. So Tracy, we note your update. I think we've approved the terms of reference you requested, so we can move on now to the next item on our agenda. And the first one is updates. So this is strategy and assurance. So really moving on really from some of the more what I would call core council business, moving on to other discussions really that and bring other colleagues into the conversation. So on the strategy and assurance section of our agenda, we usually have any updates from myself, and to be honest, I don't have a huge amount to update you on, having met you not that long ago, but also because there's probably quite a few things that I can update you on in private, which relate to things that I've been talking to governors about, like appraisals and other things that are important for your attention. But we'll deal with those in the private council meeting that follows. However, what I would like to do, really pleased to invite our Chief Executive, Angela Hillary, to come in. And Angela usually takes a slot on the Council of Governors agenda to take the opportunity to update governors about what's sort of top of her agenda and her sort of things to do at the moment. And we always think it's great for governors to hear directly from Angela about things that are happening. So over to you, Angela.
Thank you, Krishni, and good to be here. And can I just say again a warm welcome to new governors, but also for your interest in NHFT, and again for those that continue with us, thank you for your continued interest in NHFT, because it really does make a difference, and we're really pleased to have you with us. So great to share that. Just a few things then that I wanted to highlight. As Krishni says, it's often the topics that I'm thinking about that I want to share with you as governors, and I hope that is helpful. But one of the ones that I wanted to share today was around leadership, and we have a real philosophy here and belief here at NHFT that everyone's a leader, and that's really important to us, that sort of distributed leadership. But what that brings with it, I think at the moment, is quite a lot of leadership challenge. So we know that all of our leaders are having to face uncertain times, deal with challenging context, embrace change, and continually improve. And I think as the Chief Executive, that's something that I'm very, very aware of, as well as the executive team. But how we deal with that is something that we have to continually think about, because leaders are everything here in the organisation, and each one of them makes a difference. So that sort of leadership challenge and that leadership context for now is a really important consideration, and one that we're continually thinking about. Now, I've mentioned staffing, and again, I would always use this opportunity to publicly say thank you to all of our staff, our volunteers and governors, for what we're doing here at NHFT, because I hope you will see, whether through your continued work or joining us for the first time, that people do go above and beyond, and that is really important to us in our culture and what we do. But what comes with that is a constant challenge and balance around workloads. And I think it's something that, again, is very much at the forefront of my mind, particularly as we're working in integrated ways ever increasingly with our system. And as somebody's already mentioned, of course, the integrated care system. So workloads, and we're still in post-COVID environments, are really, really important for us to keep considering, and how do we reduce the burden for our staff. So that's a really important consideration, and one that remains a challenge for us to keep embracing. And then the final thing that I would mention that's very much significant, I think, at this time is obviously financial climate that we operate within, and we have within our NHFT environment what we call a value programme. Dave Mayer, the Deputy Chief Exec, I'm sure is here today as well, and he leads a lot of that work with the executive team. But as a trust, it's really important that we can deliver efficiencies and productivity and value through that programme, and that challenge is upon us and here and now. And I know that involves a lot of change, new ways of working for our teams and our staff, innovation, which Itai leads as Medical Director. There's a lot in that space, and of course we also have a duty and responsibility to work with our partners in this financial climate too. And I think increasingly, as we see the integrated care systems becoming more mature, that becomes more and more present. So the financial context, the staff and workloads, the ability to keep continually improving, and the leadership challenge are the things that I would highlight here today. Thanks, Krishni.
Thank you very much, Angela. Dave, did you want to add anything? I just thought it good, as your name has been mentioned. I just thought you might want to introduce yourself as well, Dave, because there will be occasions when Dave is here instead of Angela because of other meetings that people need to attend. But good to have both of you here today. So, Dave, do you want to say hello as well? Oh, Dave, you're on mute.
Sorry, Angela. Sorry, Krishni, thank you. Hi, I'm David Mayer. I'm the Trust's Managing Director and Deputy Chief Exec. So it's very nice to see familiar faces again and new faces too. I saw one of our DTS colleagues, Anu Palmer, yesterday. Hello, it's really good to have you on board with all of our other staff governors and public governors too. So thank you.
Thank you, Dave. Are there any? So, we've got quite a lot of our executive colleagues here today. We've introduced Angela and Dave, David Mayer, but we also have our Director of HR. We have Itai Matumbike, who's our Medical Director, and Linda, who's our Chief Nurse. And there's probably others that I can't. Oh, I think Anne's here as well, who's our Chief Operating Officer. So we have a pretty good turnout of our executive directors here, and we have a little bit of time. So if there is anything sort of pressing that you'd like to ask that we can answer, as I say, sometimes it's not possible to answer in the meeting, but if there is anything that you'd like to ask about anything Angela said, very happy to try and do that. So I'll just pause there in case you'd like to ask anything. But equally, you don't have to, and you can put it in the chat and we can pick it out as we go through the meeting if you'd like to do that. So I'll just pause momentarily. Anyone want to come in? Oh, okay. Michael, please.
Oh, right, sorry. Hi, thank you. Thanks, Angela. Thank you very much. I just think within the challenges that you've been talking about, and I think from the workshop that we had in terms of the future planning for the agenda for the Trust, again, within all of this, there must be a real challenge about capacity for individuals. And I guess it's just really within your transformation work, particularly around the challenges of leadership. What sort of contingencies, I suppose, are made for the capacity for all the governance and the financial delivery as well? Because, as you've said, that's a huge challenge. And I like the fact you recognise everybody's a leader. But that presents a lot of challenges, I think, in terms of capacity for operational managers to deliver services, as well as working in with a very complex and a changing environment.
Yeah, no, absolutely, Michael. And I think that a couple of things I'd say, and it might be helpful for Anne to also think about how from that operational space it's done. But I think it's important to say in the executive team, we constantly looking at capacity that's needed, particularly as we entered into integrated care systems. And I'm clear and confident that we've been supporting that with additional capacity through some of our director appointments beneath the executive level, and particularly when we're into group environments, we've made sure that we've reviewed the capacity that's needed. That's really important and constant, I think, because the context is ever changing. Very important to do that. At the same time, I think it's really important that as a team, we're connecting together. We do that very regularly. You know, we do that weekly to check in with people. We're also doing that through our formal governance arrangements. And again, that has to be a constant feature. And again, you know, importantly to say, and I think important to share, that through appraisal processes, within the executive team, we have a wellbeing objective as well for individuals to make sure that we are balancing and understanding individuals' responsibilities and impact on them. So it's a combination of things, Michael, in terms of that executive leadership. As I say, I'll ask Anne just to touch a little bit on that operational, because clearly the impact beyond the executive is as important and feeds up into that space too. Thank you, Anne.
Hi, nice to see everybody. Yeah, I can only echo a lot of what Angela has said, and it happens on different amounts and different levels throughout the organisation. I think that's the really great thing about having that good modelling of how we work together, have contact regularly, try and streamline as many processes as possible to try and prevent us doing things many times. Doing it right once feels a much more productive time for staff. So that's something we really want to try and do. But also thinking about well-being and how we use the appraisal and supervision system to the best effect. So I've got a developing director team that lead the operations, and we are really keen to have regular contact of a less formal nature, so that we can check in, make sure we're on the right direction and know where what direction the teams are going in, coupled with the most slimlined governance process that enables people to be able to get on with what they need to do to make the best outcomes for the patients. So I think it's in different formats of what Angela's described, but well-being and also healthy teams is really important for us. It's something that I was really championing in the mental health directorate when I was there, but it's something we want to work across much more into all the different areas in how we take the work that the OD service have put forward into all of those individual teams.
Thank you for the question, Michael. And no doubt there will be sort of, you know, more illumination on these things. And actually, what I was going to say is that we've got our staff survey results is that one of the topics on our agenda today, which I think will sort of talk about, you know, support for staff and the well-being of staff as in a broader sense, because obviously those results are a reflection of how our staff are feeling, and it was felt very important as it's relatively recent publication of those results to share those with you as evidence, really, for governors of things that are both improving but are also remain challenged in terms of our staff and supporting our staff in that very difficult context that we rightly recognise. And I can see, I think I saw that somebody else wanted to come in and ask a question. Oh no, it's Linda wanting to comment, so I'll bring Linda in. But I wondered also, Richard or Angela, if it's worth just mentioning that the fact that we've just had a well-led review, because I think Michael touched on governance, and it may be worth just sort of setting the scene for something we might want to come back and say a little bit more about as a future meeting. But I'll bring Linda in first. So Linda.
Good afternoon. Thank you, Krishna. My name is Linda Chipuzo. I'm Chief Nurse Executive Director of Nursing, Allied Health Professionals and Quality. I just wanted to add on to a few points that Angela and Anne have mentioned. So a lot of work has been done to reach out to staff to understand how we engage, communicate with them even more. So one of the things staff were saying was that they don't know what happens in other areas in the trust. So the Chief Exec has introduced our achievements and successes to share these out, and it's really galvanized momentum with the staff. People are keen to share the successes and achievements. We've also just last week had Dragon's Den, where staff come in with innovative ideas that they present, and then they can get a bit of funding to then carry out those innovations. Again, there's the focus on keeping the workforce motivated, embracing innovation and the talent that we have across the organization. That does a lot for staff morale and well-being. Thank you, Chair.
Thank you very much, Linda. So a couple of questions that just colleagues, Richard, sorry, do you want to come in on the well-led piece that I've mentioned, just to tell governors a little bit about that, although we will need to come back to that in due course.
Yes, of course. So governors may be familiar with the 5 key questions that the Care Quality Commission ask when they come to undertake inspections, one of which are services well led. There's a counterpart to the CQC inspection regime that's run by NHS England, who tend to look at leadership and governance through more of the governance and finance lens. So as part of the national guidance, we as an organisation have to commission an external developmental review of leadership and governance every 3 to 5 years. We've just completed that review process for the latest review and are expecting to receive our results over the next month. So as and when we do receive those formal results, we'll then be able to provide some further assurance to the Council and indeed to talk about the actions that we're going to take based on the learning. Thanks very much.
Thank you very much, Richard. You have frozen on screen, Richard, but we can hear you all right. I just wanted to make you aware of that in case, I don't know if it's just me, but I think I can certainly, for me, Richard has frozen on screen. So just to mention that. I think also worth saying, and sorry, Richard, if you said this and I missed it, but governors were involved in the process of that, but obviously that was prior to new governors starting. So governors were, a focus group took place that involved governors as well as an input to that well-led review. So worth mentioning that. A couple of other questions that I'll just try and pick up because I think we've got the time to do that. So one from Sheila about understanding the efficiency programme. And so it might be useful if one of the execs could just explain a little bit about how we identify efficiencies and then oversee the programme to make sure it's safe for us to deliver. So Dave, I'll bring you in on that.
Thanks, Krishni, and thanks for the question. Yeah, like all NHS trusts, we have an expectation to deliver financial efficiency alongside our partners in the ICB. So the ICB, the Integrated Care Board, which manages about 1.7 billion pounds worth of public resource for health spend, have an efficiency target of about 55 million this year, of which NHFT will be expected to contribute about 17.9 million as part of that. So we've got a programme of work doing this. We've done it last year as well. We delivered a significant efficiency programme last year using non-recurrent means in some ways and efficiencies in how we use contracts, etc. So we're ramping up some of that this year. And some of the things we're looking at are where have we got services that have been underfunded traditionally, and can we negotiate better rates for how those services are paid in the future with our commissioners? Some things relate to looking at where we have long-standing vacancies, a question about whether those vacancies are needed or whether we can do something different with them. We're looking at our use of agency particularly, which is a big driver of our cost. And our agency staff are much valued, of course. They make a real contribution to patient care, but it is a very expensive and inconsistent way of delivering support for services and for other colleagues. So we're looking at all of those things in around and coming up with, I hope, quite a balanced plan that will allow us to transition to a different way of working over 24-25, which is focused on value, and value being something that we want for patients, for our teams, as Angela and Anne have said, and for taxpayers. So making sure we get best value from everything we do, and that's a major thematic of the work going forward. And there'll be more of it next year as well and beyond, I suspect. Thanks, Christian. Hope that's helpful.
Thank you, Dave. And actually, one of the things that you'll hear as governors is some feedback from our external auditors about our track record in delivering efficiencies historically and how we deliver value. So that's one of the things as governors that you play a key role in appointing our external auditors, and they make sure that we are delivering value, we are sustainable. All those questions then get answered as part of that process. So you'll hear more about that in the coming weeks and months. But actually, the efficiency programme is a key part, as Dave has described, and Angela referred to earlier, of our delivery in terms of finances this year. Another question that came up, which I just want to pick up, because it's a slightly different question. One from Anu about really sort of inconsistencies in leadership response to things raised by, for example, staff networks. And I wondered whether either Angela or Chris would like to just respond about leadership development and how we're trying to equip leaders to manage and respond to concerns that members of staff are raising. Chris, did you want to come in on that?
Yeah, we've just recently, we've had a very progressive interactive leadership program for a long time called Leadership Matters. We've recently reviewed that, and it is now actually targeted at managers around bands 6 and 7, those looking to progress, and those above that are also targeted and included, and that's called Excellence in Leadership, which is really focusing on how you support staff, how you deal with them. It has a whole section on inclusivity. We've also developed a very sort of, I suppose, so very engaging but also challenging course on inclusive recruitment, which all the senior leaders are going on, which is an area where we do get concerns raised both by staff generally and ethnic and cultural minority staff. And in addition to that, the HR team are sort of refocusing the offer that they have, so we ensure it's more people focused. And we are developing alongside that a number of training programs for managers that have the more management skills element of the processes. So there has been quite a major revamp of that. It has been progressing. People are going on the courses and developing the skills, and then further work will be being undertaken. Those are training courses approaches, but we've also got engagement with staff, with the senior leadership team, with the work we do with the reach networks, all of our networks, to look at how we can work with managers and staff to ensure processes and approaches are managed to meet, the needs of staff where they're raising concerns. So there is a substantial amount of work going into this, Krishni, that we are developing and we are seeing an impact from, albeit we recognise this is quite a challenge to respond to.
Thank you, Chris. Apologies, I realise. So I think that's the start of an answer, Anu, and I think you'll hear more about some of that work. And certainly, actually, when we pick up the staff survey results as well, I think we'll no doubt be picking up some of the themes from that. Itai, my apologies. I think I spotted that your hand had gone up, but I didn't bring you in. And I think you were just going to comment additionally on the efficiencies. Did you want to say any more on that?
Yeah, so in addition to the comments I made in the chat, that obviously the value program is is supported by clinical directors who ensure that patient safety and quality is not compromised in pursuit of doing things more efficiently. It's also pleasing to note that with the sort of co-production culture within the organization, where innovation is coming from clinicians and operational managers who are at the coalface. Some of the ideas that we get in, for example, the Dragon's Den not only improve the patient experience, but also make a significant savings from the trust's perspective and also in the system. So it's just one of those things that wanted to just give some reassurance about how efficiency is everyone's business, because we have to be a solvent organization for us to provide the quality care that we do. But at the same time, we're seeing more and more that the involvement of our staff is enabling us to deliver that efficiency with better patient experience and outcomes.
Thank you, Itai. And of course, increasingly, I know colleagues, governor colleagues have asked in an earlier workshop and commented also about the importance of co-production. And I think what's really helpful is to increasingly see peer support workers included as staff and volunteers who then contribute as well to the improvement opportunities. So it sort of really becomes a very well-established way of working, which is really positive, but always more to do. Just to say, I think the important thing to say is that with all of these things, there's a lot of things happening, but there's always more to do and always more to work on. So part of our DNA is trying to keep that focus on continuous improvement. One more question that I'd just like to address before we move on. I think Adam raised how are potential future winter pressures considered in the context of efficiency savings? And this is really just about making sure that necessary capacity is retained. It's sort of anticipating winter pressures. Anne, is that something you'd like to come in on at all?
Yes, and I think the way that we're working now in a system has really changed that sort of whole agenda, from how we make efficiencies to how we plan for winter. And I'm pleased to say that we've got a summit around urgent care coming up very firmly in the summer to start thinking more concretely about how we move forward with some of the pressures that we know are more enhanced in the winter. It's very challenging, as we see often across, in the news and things, about pressures in hospitals and ambulances, and we've got the whole system is part of managing that process, and a lot of our services, frontline services, support into that urgent care pathway, and we need to maintain that we've got the quality and the safety within there, which is what our colleagues in Linda's department support with, but also recognising the challenge financial pressure we're in, which is why we have to come together to work out how to manage the risks and the staff support and everything in one place. So that conference is in July, and it just brings all the senior leaders together to focus on the winter that we are due to have. I hate talking about winter in the middle of summer, but I know it's not far away.
Thank you, Anne. And I can see a hand has just gone up from Julia. So Julia, do you want to say hello and just remind everyone who you are, Julia?
Thanks, Krishni. Hello again, everybody. I'm Julia Curtis, one of the non-exec directors and deputy chair. I just thought it might be worth adding in that one of the sort of fail-safes, or that one of the processes that we go through whenever efficiency savings are looked at, is a quality impact assessment and an equality impact assessment. So the executives responsible for each of the different efficiency savings as part of the value programme are undertaking those impact assessments and then reviewing them. And I know that Itai and Linda have oversight of those. And whenever we're on calls, we're questioning, have there been quality impact assessments for additional assurance. But it's just a really important part of the process of determining when we're going to make some savings. And some governors might not be aware of that, so it's just worth throwing that in. Thanks, Krishni.
Thank you, Julia. So colleagues, I hope you found that useful. It's a really good sort of opportunity to talk about, you know, some of the broader issues that we're dealing with at the moment, and usually prompted by Angela's input at this stage. And you will, as I said earlier, see Angela or Dave regularly at this session, along with many exec directors who do try and attend as much as possible, so that you feel that, you know, we can facilitate answers to some of the questions that you clearly have, and hopefully you've had some helpful answers today. I'm sure that there will be other follow-up things that you'll want to know, and we can of course pick those up with you. And one of the things Richard will do, Richard and the team will do, is explain to you how we will do that in due course. But thank you very much, Angela, and everybody for responding, and certainly for the questions that colleagues have raised, which I think were really useful. So I'm going to take us on to our next item, and this is actually what we called a staff governor story. So I'm going to actually, some of you have met Richard already. Richard is our member of our staff. He's been recently re-elected as a governor. He's also our interim lead governor, but he's worked with the organisation quite a long time. And what we've found helpful in our councillor governor's agenda is sometimes to bring colleagues in to talk about their experiences, either as a staff governor or as a partner governor, and indeed in other ways as well. So today we thought it would be helpful for you to hear from Richard, and for him to share some of his experiences, both as a governor, as a member of Team NHFT, I suppose. So Richard, over to you.
Thank you, Krishni. Good afternoon, everyone. My name is Richard Amponsa, and I've worked for, sorry, I was, okay, yeah, I can see that now. Yes, I've worked for the Trust since 2006. So I'm just going to take a few moments to tell you just a little bit about myself, what my day job is about, what are some of the rewarding aspects, what are some of the challenging aspects, and how my role as a governor kind of links in with my day job, or the other way around. So I kind of stumbled into nursing, really, because I came into nursing as a matured student. So a friend of mine, I was born and raised in Ghana, and a friend of mine who I was talking to at the time, I've worked in hospitality. So I worked for the French hotel chain Novotel, involved in trying to drum up sales for the hotel and selling their conferencing and non-residential and residential packages. I've also worked in exporting of agro produce, basically fish from Ghana. So I've worked in the kind of the shipping field as well. But it got to a point where I really wasn't fulfilled. I just realized that if you didn't speak French, your prospects for kind of growth and development in the company were a bit limited. So I started to look for something different to do. But in doing that, I spoke with this friend, and he just recently returned from the UK, and he said, "Have you considered nursing?" Because he said, "I've been talking to a friend of mine, and he's been a mental health nurse. He trained in Bedford University, and he's really enjoying himself. And I think looking at you, knowing the both of you, I think you have a lot in common in terms of your personality and the kind of things that make you tick. So if you look into it, I think it'd be a good idea." So I said, okay. So I did some homework, and I happened to be on holiday in the UK, I think 2 months after our conversation. So I went to an open day at the University of Hertfordshire. I got some information, and then I applied to join the cohort as a mature student. So went back to Ghana, applied for my student visa, came back, started my nursing career, nursing training at the University of Hertfordshire, and I started properly with them in August 2004. So I started work at the Queen Elizabeth II Hospital in Welwyn Garden City, and I think 16 or so months after that, it got a bit too expensive for us to live there because all the guys from London were coming up to Welwyn Garden City, which is a really nice town, and just buying up all the properties. So we couldn't afford to buy there. So we moved up to Kettering. So that was in February 2006, where I started my career as a nurse, staff nurse on the then mixed gender ICU, which was Teal ICU. So that's where I started, and I've kind of worked through the various different services in the community and on the wards, and I'm currently interim assistant director of patient safety, safeguarding, and clinical investigations. I've recently successfully interviewed for the position of deputy director of nursing, quality, and AHPs, but the date is yet to be confirmed. So at the moment, this is what I'm doing. Tracy, can you go to the next one, please? Right, so what's my day job like? So as I said, everything that I do is really about promoting patient safety and enhancing patient experience. That is, in a nutshell, that is what my job is about. So in addition to the normal appraisal and supervision that you do, and the one-to-one corridor chats that you have with colleagues, and whether it's a meeting, which is, for example, the review of significant events for learning, which is our rebranded internal assurance meeting, which is one of our key kind of governance forums for ensuring that cases of medium harm and above that occur within our organization are reported on, thoroughly discussed with members of the multidisciplinary team, and then we make decisions as to what learning can we take from these incidents, and how do we assure ourselves as an organization that these incidents that have happened, that we're mitigating them, and that we're either eliminating the risk of them ever happening again, or that we're putting in strong mitigation to ensure that, if it happens, that the effect of it is not as devastating to patients or to carers. So that's just one meeting. There's the recently introduced director-led pressure ulcer review group. So for those that know, we typically would put in an incident report on Datix, just to talk about, if there's been a pressure ulcer. Now, the new way of doing it is we're not doing it through Datix, because if you've been an ops manager, you know that sometimes when incidents are reported and you're done as the handler, it can take you anything from a week to several weeks before you actually have the opportunity to review those incidents and just to discuss it with your patient or with your staff. So what we've done, which is different and is new, is that our tissue viability nurse worked with Hertfordshire Partnership Trust. They were doing something different, which was getting results for them. She ran it past Linda, our chief nurse, and Linda asked me to start chairing this pressure ulcer review group. And we've come up with a new way of reviewing and managing pressure ulcers within the trust. So what we do now is every fortnight prior to our Rhodes meeting, we'll have a meeting with all the clinical leads around pressure ulcers that have been reported to our organization, especially those that of category 3 and above, and those that NHFT is responsible for. And by that, I mean those that have happened whilst the patients have been in our care. So we'll look at that, and then we'll take assurance from the leads as to what has happened, how are they managing it, do they have all the equipment in place, the patient, for example, being tested on a regular basis, all those kind of things. So we'll look at that. So that's a far better way of doing it, because we do it promptly, we take the learning almost immediately, and we apply to our clinical practice. Some of the things that I do as part of my work is I do attend sometimes system quality group meetings on behalf of Linda, where we share success stories, challenges, of course, with our ICS partners, and importantly, learn from other organizations. The most challenging part of my role, time, is always pressure, but I think meeting families, patients' families, when there's been an incident of harm is really difficult. Especially when you come across lay people, of course, who will say, Richard, if only my loved one had been detained under the Mental Health Act, they probably wouldn't have come to harm. And it's difficult to explain that. It's not as simple as, sometimes we say, we want this person detained. Sometimes lay people think, okay, yeah, you can just ask for somebody to be detained and that's it, they will be detained. But there's a process. Of course, a family member can ask for a mental health assessment, and then we gather together the professional to undertake a mental health assessment. And it's based on the outcome of that the patient may be detained. So trying to explain that sometimes to a relative whose loved one has come to harm is very difficult, because they don't understand why. They know the patient best. They've lived with them for all their lives. and if they think the person needs to be in hospital. But we are talking about, their capacity to make decisions and working with them to adopt the least restrictive option so that we don't necessarily have to put them into hospital if they don't want to be in hospital, but are willing to engage with us and work with us in the community. So that can be challenging. But the most rewarding part of the job, if I turn it, on its head, is definitely patient satisfaction stories. When you sit in a room with somebody who says, this person has made a massive difference to the outcomes, of my loved one. I mean, we share Motivation Mondays, where people just share some of the fantastic stories, and and especially when it's coming from some of our lowest banded professionals. So it just goes to show, when Angela talks about everyone being a leader, it is just something about it. It's not about your banding. It's not about your title. It's just about having a heart to want to care and to go the extra mile for people. And for me, that is the highlight. When I have experiences where people are telling me about the difference that a member of staff has made to the care of themselves or their loved one, that is just, it just makes my day. So it chimes with my values. So I really, really do enjoy those kinds of stories. Now, how do all these kind of link in with my role as a governor? So, I'd like to link it back with our vision to be a leading provider of outstanding compassionate care. All our programs and activities, as I said, aim to support that vision, which of course is drawn from our, DIGBQ strategy, which is developing, innovating, growing, building with quality as the base. So just taking part in all these discussions and decisions, being able to contribute at these forums, and being part of a group of people that hold our net to account as they in turn hold the board to account. That that really is, there's a direct link into the job that I do. So for example, we talk about reflect and reconnect, which is where the organization gives time for staff groups to just set time aside to just think about their work and just how the impact they're making, and look at what areas they can improve their work. Being part of those discussions, of course, there's a financial commitment to it, where the trust has to vote some money to get that done, or whether it's giving some making changes to the way that staff, staff that travel a lot as part of their work are rewarded in terms of, transport and, all those things. Being part of those discussions, all that ties in with my day job. So as I said, everything that I do has to do with making sure that patients have the best possible experience and their careers. And of course, talking about staff, because if we don't have a well-motivated, well-trained, equipped staff, then we cannot do any of these things that we're talking about. So yeah, that's in a nutshell, that's what I do. I really enjoy my job. One thing I've recently had the opportunity to be involved in was this, what Itai and Linda talked about, Dragon's Den. Our last session last week, Friday, was really fascinating. We had 6 pitches. All of them received funding for their projects, and we're judging it based on sustainability and the ability to make a difference to patient outcomes. And I'd just like to give one example and finish there. So this was about the intermediate care team that piloted the use of what they call an elastomeric device, which is basically a device that is able to administer 24-hour infusion of medication, intravenous medication. And this innovation apparently is being successfully trialed in Mid Yorkshire Teaching NHS Trust. And the benefits are just amazing. If you think about it, the member of staff that delivered this told us that just from a patient that was on 1 medication, not 2, and remember, patients sometimes can be on once, twice, or 3 times medication. For just that 1 patient, it would save us, our district nurses, 350 visits. Just think about the positive impact on our carbon footprint, just the cost of transport, the expense, and this is something that is already being successfully used. So the benefits, as I said, are just endless. Improving clinical quality and staff capacity, reducing risk of infection because there's less handling of the device. You don't have to keep going in and out, providing value for money, as I said, by reducing travel time and expenses, offering patients choice and flexibility, and overall improving their lives and the quality of care. It's just amazing. So yeah, I want to end by saying definitely I enjoy my work, and I would definitely always recommend NHFT as a place to work and to receive care. Thank you for listening to me.
Richard, thank you. That's like a very powerful, sharing of your experience, really. I probably have said this before, and other governors. Richard was one of the first members of staff I met on my, literally, because he actually showed me around the trust on my interview day. So before I'd even started, I don't know if you remember that, Richard, you had to show the candidates round. And so he was one of the first members of staff I met on however long ago that was. So I feel like I've known Richard for a long time as part of my journey. Thank you, Richard. Really, I think powerfully what you've talked about as well is not just your experience as a member of staff, but actually that we touched on, I think in our earlier conversation where the governors were involved in a workshop about our plans going forward. And I think we touched on innovation and research, and questions were asked about technology, and that what you've given is a sort of example of an innovation really that seems to, from what you were saying, ticks so many boxes. It's more efficient, it's better for the patient, it's better for staff, and that's exactly the kind of innovation we really, it's so exciting to hear about. And it's great that we've learned that from somewhere else, because I think the NHS is often criticised for not learning from other organisations. So it's really great to hear that. Heather, did you have your hand up and then it went down? I thought I saw it, but am I
Yeah, it
right?
was by mistake, really. I was just clapping.
Okay.
Yeah, sorry.
You were clapping. Oh, well,
Yes.
that's nice anyway. So we record your clap for Richard. So were there any other comments or questions relating to anything that Richard said? We've touched a few times on Dragon's Den. There's a great video that people might want to see. That's probably on our website somewhere, or we can maybe recirculate that. There's a lot of things, Tracy, I think we've talked about sharing with some of our newer governors, but I think Melanie features in the video that I saw, because lots of different colleagues were involved in that. But it is, the Dragon's Den process was very much led by Itai, but lots of colleagues have been involved in terms of getting, really hearing about opportunities for improvement and innovation, and awarding small amounts of funds to help people take those forward. So you heard directly an example there from Richard. Itai, did you want to come in on anything that you heard from Richard?
I was just, smiling to myself because the first time Richard heard about Dragon's Den, he was not very convinced, and then we thought the best way to sort of get him, interested in how it works was to make him a dragon, and he's just loved it. I think. What I would say, the best thing about Dragon's Den has been the kind of involvement of all our staff in it. I think it's growing in the sense that we're getting more and more applications. And the more we talk about it, the more we share some of these amazing stories of these innovations that improve patient experience, address health inequalities, improve efficiencies, quality, and just the way we operate as a trust. The co-production sits front and center of everything that we do. Thank you very much, Jan, for sharing that on the chat. And so I think we've had non-execs getting involved in Dragon's Den, which is almost like a live holding to account of what we are doing with the funds that we as an exec team are using to provide services. So that's been one of the beauties of it, and what they bring to Dragon's Den is an understanding of industry outside of healthcare. And they ask the questions that some of us who are just jobbing clinicians wouldn't normally ask. They ask, and increasingly, I've started to sound more like an entrepreneur when I'm asking questions, simply because I've been listening to Mal and Judith asking those types of questions on Dragon's Den. But I think there's a real moment here in terms of, NHS is really challenged. We've got a lot of money that we need to save, but we don't have to do that by slashing and burning. We can do that by innovating, and doing things in a much more efficient way. We can save money, we can improve patient experience, we can improve safety and quality. And I think that's the beauty of the Dragon's Den and the whole process. So please do encourage staff to pitch their ideas to us. We're always keen to hear what the next best thing is going to be.
Brilliant. Thank you, Itai. So the video, I think one of the videos, if not more than one, is available in the link there if you want to watch it sometime. And I'm sure we can also send it out separately. But I certainly enjoyed it. It was really, really lovely to watch it happening. So thank you to everyone who's been involved in that. And Michael's made a comment which perhaps we can think about as sort of one of the because probably don't have enough time now to go into it, but it would be helpful to understand how NEDs triangulate and verbal written follow through with the financial quality agendas. So I think and I think that's a really good question. So perhaps I can ask NEDs to think about that, and maybe we can pick that up in a future assurance item, because it is a really important, getting the balance right between finance and quality is a really important question and challenge for us. So it's something we will need to come back to. So thank you very much, Richard, for your story, and really appreciate you sharing that with us. And we'll look at involving other governors as well in that process of sharing your experiences and insights, which are really helpful, I think, for colleagues. I'm going to move us on now to item number 9, which is bringing in a couple of our non-executive directors to present on a topic that we feel is important for you to understand. And this can vary from finance to quality to sometimes both, as Michael has rightly challenged us. So different areas of assurance that non-executive directors have perhaps explored and feel it's important to share with you. So today the topic is our staff survey results, and we've got 2 non-executives involved. So I'll let them introduce themselves, Melanie and Tim, and hand over to you both to take us through this topic, please.
Thank you. Hi, I'm Melanie Hall. I'm the Senior Independent Director, one of the NED teams. I also act as a Wellbeing Guardian, which every NHS trust is required to have. So I have a particular focus on staff wellbeing, and I'm also the Freedom to Speak Up lead. And I think it's with that sort of background that the staff opinion survey is particular interest. But before we start the presentation, Tim, would you like to just introduce yourself first? Because we're going to do a double act for you.
Thank you, Melanie. Yeah, I'm Tim Harrison. I'm an Associate Non-Exec Director. I've been with NHFT since April 23. I'm also the Chief Executive of Primary Care Performer in Cambridgeshire. But before I came to NHFT and the NHS, I was 23 years in the John Lewis Partnership, which is the UK's largest employee-owned organisation. And they've been doing staff surveys as long as I was in the business, since 1996. And so this is an area that I know is really important to the overall performance of an organisation. Thank you, Melanie.
Thanks, Tim. And we're going to give you a bit of an overview of the 2023 National NHS Staff Survey. And just before we get into it, I think it's important to understand that this is an NHS-wide survey. It is really comprehensive, covering all aspects of work within the NHS. Every single trust participates, and that enables us not only to receive results for our own individual organisation, but also then to benchmark, sometimes down at question level, and that information is widely available for trusts to be able to look into the detail of the questions. And it's a significant area of learning for us, but it is a standard survey. It's not bespoke for NHFT. And that does bring its own challenges when it comes to sort of responding to something that is very concrete and not dynamic. So the survey goes on every single year. And what we're going to talk about is last year's survey. It takes place between sort of September, October. We typically get the results through in sort of February, March, April. So if you'd like to move on, I think one of the most important things to also consider is that although we have this annual staff survey, it is just one small part of the wide set of tools and the wide set of insights that we gain into staff satisfaction and how our workforce are feeling. And I thought it might be useful, before I hand over to Tim to go through some of the results of last year's survey, to just touch on briefly some of the other areas that we use, so that we get a really rounded picture of how satisfied our staff are. So the annual survey is complemented by a quarterly pulse survey results that we do here at NHFT that gives us a snapshot every quarter of some of the key questions that we want to know. We also have routinely workforce reports and a wellbeing dashboard and insights that are presented at committees, in board meetings, and we have a very well established wellbeing sort of leadership and strategy program within NHFT, and there's a wellbeing steering group every month that looks at wellbeing metrics. So that's another key indicator. Of course, as NEDs and as execs, we go out and about on service visits. We join team calls. We meet with staff individually, and we use all of those different touch points as an opportunity to ask about how satisfied staff are, how their well-being is. We have staff stories at development workshops and at Trust Board that offer us another insight into the work of our staff and where their pressure points and successes are. We deep dive risks. We have 2 risks on the BAF relevant to our GROW strand of our strategy, around workforce capacity and around well-being. And monitoring those risks are another key insight for us. We look at freedom to speak up through our Integrated Assurance Committee, myself as Freedom to Speak Up, Ned Lead work very closely with the Freedom to Speak Up Guardian to understand potential questions, consistent themes. And we also have feedback that I receive both directly and indirectly as the Wellbeing Guardian. So through all of those different through all of those different avenues, we gain a really strong insight, I think, into how staff are feeling. But the survey gives us a particular benchmarkable touch point every year that is a really useful set of insights. So I'll hand over to Tim now to take you through the results from last year.
Thank you, Melanie. So what's really important about this slide is that it starts to put some quanta around the survey. But we'll start first of all, and I think it's really important to look at the response rate, and that's a hugely important measure. The reason being is the response rate gives us confidence to act on the results because it represents the views across NHFT. If you have a low response rate, it suggests the staff are uncomfortable to give their feedback, share their thoughts on NHFT in itself. It may suggest actually there's a wider cultural challenge we face. However, quite the reverse is true here actually, and it's a really pleasing result to see the improvement from 46 to 60%. So a 13.6% increase in the highest ever response rate. So an idea of scale, that's 2,915 people, staff's view. If you include bank, it takes over 3,100 people. So it's really important that we understand that this actually is a good representation of what people are thinking inside the organisation. Also, the staff engagement score at 7.3% is really important. So this provides us with a good sense that the data we're looking at is robust and is what people are thinking. Below, and I'm sorry about the size of the image, but actually just to give you a sense of what this is saying, our results are above average for every people promise element. So NHFT is the dark blue column in each one of these elements. The light blue is the average result. And as Melanie said, this is our opportunity to benchmark our results against others. And as you can see, for every one of those scores, not only are we above the average result, but we're always towards the top end as well, near the very best results. So about compassion, recognising rewarding staff, they have a voice that matters, that we're safe and healthy, we're always a learning organisation, we work flexibly, team, staff engagement and morale. So actually this is a really good result for us, but we shouldn't be complacent. And as Angela touched on, we're a learning organisation. So what else can we learn? So can we go to the next slide, please? So our results show high levels of improvement in some areas, but actually there's also, as we said, some areas of improvement. So more staff now recommend NHFT as a place to work. Significantly more staff experience compassionate leadership, and this relates to what Angela was saying about everyone is a leader. We have greater numbers of people feeling they're working together. We meet regularly to discuss team effectiveness and have a good understanding of roles. Fewer staff are now feeling unwell due to work-related stress, which is a growing problem within the UK. So again, we're making good progress in these areas. They feel their immediate manager takes interest in their health and well-being. There's been a large increase in the number of ethnic and cultural minority staff sharing how it feels to work at NHFT. But we have seen decrease in staff feeling involved, being treated with respect by their colleagues and by the public in particular, and secure in raising concerns about unsafe clinical practice. So if we can move on to the next slide, we'll talk about how we're going to deal with that. But before we do, just to continue the theme, there's been an improvement in relationships between managers and colleagues. 2 strands of the workforce pillar in our Together Against Racism programme have focused on opportunities for career development and addressing racist behaviour. And our results this year show further work is required to ensure our ECM colleagues have the same experience as their white colleagues, which must improve. There have been improvements for staff with disabilities and long-term conditions that they feel valued by the organisation, and we're making reasonable adjustments for them. Staff with a disability are feeling valued by their immediate manager, which is great. And our results show further work is required to ensure colleagues do not feel pressured to come to work when they're not feeling well enough to perform their duties. And I think at this stage, well, that's really good. We should talk about the Let's Talk programme and how we make sure that we're engaging everyone at all levels. What do we do with these results? The plan's got 3 levels. The first one is engagement for issues that are a theme across the whole of NHFT, so things that are affecting everybody. Level 2 is concerns with particular groups. And then the final one is identified at team level or at service level. So you're able to go down to detail and look at particular areas and particular themes with particular teams. And that's really important because it's important that people feel that their voice has been heard. To maintain this engagement, we've got to make sure we continue to respond positively to a survey of this nature. And I'm going to hand over to Melanie.
Thank you, Tim. So I appreciate that was a really sort of quick canter through what is an incredibly detailed set of results, but I think Tim really drew out the highlights and the areas where we're still focusing. But if we reflect as NEDs, and to draw on Michael's point really about how do we triangulate, it is really important that we don't just hear this information, that we try and understand it in the context of everything else that's going on. And so the way that we receive assurance that the organisation is listening, that these results are acted upon, are shared, and that a continued focus remains on staff satisfaction and dealing with our areas of focus, we have a range of different ways that as NEDs we do that. So again, we would turn to the way that we review our most significant risks around workforce and staffing levels, workforce safeguards, and the well-being, particularly on the BAF risk, are all regularly reviewed through the Integrated Assurance Committee, which Tim actually chairs, and is a key committee for us to understand workforce challenges and successes, and to reflect on what the data is telling us about the various things that we want to measure across the workforce. We routinely review the workforce disability equality system and the workforce race equality system through the board. And we also have an Equality and Inclusion Advisory Board in NHFT, which Judith sits on as one of the NEDs, to seek assurance about the particular programmes of work that are going on to address these 2 areas, which, as Tim reflected, still have focus strongly upon them to improve in the staff opinion survey. I sit on an integrated care system, on an integrated care board committee called the Integrated Performance and Resources Committee, which routinely reviews the ICS people plan and the workforce plan that has been developed to respond to the people plan that's set by the NHS England. We have myself as a Wellbeing Guardian attending the Wellbeing Steering Group, and we hold regular reviews with senior manager and the board. And also, I particularly focus my service visits on areas where wellbeing or issues raised at team level or in the staff opinion survey might be more prevalent. The staff opinion survey is shared widely across the organisation, and every team is encouraged to develop action plans, and that's supported by the Let's Talk programme that Tim referred to. So as NEDs, when we're out and about on our service visits, we look for positive evidence that the survey results have been shared and that action plans are in place. And we also, recognise that this is something that is a continuing, developing area of focus for the Trust. Of course, as different things happen in the environment that can affect staff satisfaction and wellbeing. It's been a difficult time in the NHS. So it's an area of real focus. And I think that NEDs are constantly seeking to gain greater visibility, for example, of the Let's Talk engagement plan and delivery, greater visibility and ease of accessing the metrics. So it's an area that we particularly focus on ongoing. So I think that's the end of our formal presentation. Tim and I now, I think, are very happy to take questions.
Thank you both. Thank you very much. So is there anything that anyone would like to clarify or raise any questions about regarding any aspects of that presentation? Or were people happy that it was clear? Sheila, please.
Hello. Just really a comment. It's just disappointing still, isn't it, that some staff feel that they can't raise concerns about clinical issues. And I know that the Trust does an awful lot of work to try and encourage staff to do that. But I think in terms of clinical safety, it's really something that I mean, I don't know how we do it, because you do a lot, but I think it is just so important that we try and encourage staff that it is okay to to flag up if they've got concerns.
And it's a really good point, Sheila, and one that we discuss with the Freedom to Speak Up lead, the Guardian and the programme, because this is about how do we build on what we already have, which is a fairly strong Freedom to Speak Up culture and sort of set of regular issues being raised, but how do we continue to make people comfortable? And I think on a positive note, we see an increase in the number of Freedom to Speak Up concerns being raised openly rather than anonymously, which speaks to a greater level of safety that staff feel in raising concerns. And, we are getting much better at enabling people to get swift and rapid responses to concerns that are raised, and also making sure that lessons are learned and that learnings are then shared. So I think it's an area that we continue to focus on. I know the Freedom to Speak Up Guardian has taken the results from the survey and is now building them into a strategy to continue to drive that openness. We also get a lot of feedback from our Freedom to Speak Up programme to find out what and why concerns have been raised through that route, or why people haven't raised concerns. So it's an area that we continue to focus on. And as NEDs, as a Freedom to Speak Up lead, I'm party to that work and seeking assurance from the Guardian that work continues.
Thank you, Melanie. I think a couple of other NED colleagues would like to come in, and perhaps people could give some thought to responding to Heber's question. What is the plan for negative feedback that flagged from the result? So I maybe bring Tim, and I'm assuming that's negative feedback from the staff survey results, but is that right, Heber? If that's right, we can try and answer that. But actually, I'll just bring Julia and Saqib in, and then perhaps Tim or Melanie can come back on Heber's comment. Julia, please.
Thanks, Brittany. It's just to give you another example of where we do try when we're out and about to raise the profile of speaking up. So I was with a group of over a dozen newly qualified clinicians of all sorts of disciplines. There was a podiatrist and nurses and physio, and I talked to them. I had a little slot on their new preceptorship programme, and it was one of the issues I raised, and I said, you know, we absolutely need to hear never ever let unsafe practice go ahead if you've got issues with managers, issues with behaviours, etc. And actually they knew about freedom to speak up, which was great. Some of them had been in the trust a little while, but some had only just started, so I was quite pleased that some of them had actually, well, all of them had actually heard about it, but that they were nodding to say yes, they felt they could actually raise a concern. That's always interesting when it's played out, isn't it, when it actually happens? But actually for new staff to know that and understand that, and for us to just reiterate at every opportunity we have, it's just one of the places, literally from yesterday, that we were able to do that. So I think it is there's lots of ways we do raise it, but actually it's a continual drip message too from all of us, I think, to help people feel confident to raise issues.
Thank you. Saqib?
Yeah, I was just going to highlight sort of in terms of both positive and negative feedback, other opportunities that we have are from hearing from staff governors, the staff employee groups like REACH, learnings that we get across the group from LPT, because obviously with some of the demographic we've been talking about, there's also a large makeup of that staff in LPT. And then that grouping, and then particularly other events on a positive front, celebration events, living values, long service and quality awards. So there are different ways that on top of what's been mentioned by Melanie and Tim, that we interact with staff and get to hear things both positive and negative. So I just wanted to highlight that.
Thank you, Saqib. Really important because, you know, freedom to speak up is one route, isn't it? But actually, you know, people can just have conversations with anybody they feel comfortable to talk to. And in a way, that's the most important thing we've got to create is who do you feel comfortable to talk to about your concerns, and can those concerns be rooted through those people and taken forward? Because in principle, you know, if we don't know that somebody's got a concern, we can't do anything about it. And that really, as a very basic tenet, I think encouraging people to use whatever route they feel comfortable, that becomes really important. And just to say, before I bring Tim in for a final comment about addressing that negative feedback, so in addition to the regular routes through which Freedom to Speak Up data and concerns raised are raised at Quality Committee and through various, and to the board as well. I think we're due the annual report on Freedom to Speak Up to the board at the next meeting, if I remember correctly. But Angela, myself and Melanie, as she's the Senior Independent Director and the lead for Freedom to Speak Up from a non-executive point of view. But Angela, myself and Melanie actually get together with the Freedom to Speak Up Guardian every 3 months, I think, or every quarter, I think, to understand what issues are occurring. And this is really all part of making sure that we're taking these concerns that we're hearing about very seriously, and we're doing our very best, notwithstanding that there will sometimes be difficulties for people in how they feel about speaking up, doing everything we can to try and you know, create an environment where those concerns can be raised. Final comment then from Tim, please, on how we respond to the staff feedback and the improvement.
I was actually going to comment on two of the comments that are in the chat, actually. But the first one from Heber about the negative feedback. It's really important that we respond to that, either through the Let's Talk or You Said We Did, simply because it's really important that people understand that making a comment actually gets responded to. If you don't respond to it, then actually what's the point in actually filling out the survey next time? And the reason why we've got the response rate moved so far forward is this has been an area of focus. So rest assured, that negative feedback is really important. If we want to continue to make this a valid and measurable thing that we can use in the future for good action, then we need to make sure we are responding to it. There is one other comment in the chat I was going to pick up on, which says, could it take place half yearly? And I'll just refer to Melanie's first slide, which talked about the fact this is an annual survey, but there are quarterly pulse surveys and there are other means of assurance as well. So we are constantly just keeping an eye on it. And that's everything. Thank you.
Thank you, Tim. And I think Adam makes an important point that some of, the reports that people hear from different settings and different organisations about the treatment of whistleblowers, it could put people off. And and actually, it only takes one experience, doesn't it? One bad experience, potentially, that's then shared with other people to say, well, I suffered because I raised a concern. So I don't think it's something that we can completely, make sure 100% at every moment in time it's perfect, but it is something we have to recognise we continually have to work on, because it requires all of us to take every concern every concern seriously, for people to feel really, really confident. And so, part of that is about making sure people are equipped to deal with it. Everyone understands what's happening at induction, all of those things. So it's a perpetual effort, which I think is what's really important. And I think that's probably the sort of key points. There are other comments in the chat. Yes, Angela and Dave also take an executive lead role with Beth, who's our Freedom Speak Up Guardian. We also have, I can't remember the exact number, but champions now from all different backgrounds, and about 40 41. People, 41, growing number all the time, trying to encourage people in the organisation to speak up and try and help people find the right route to raise concerns. So this is something you will definitely hear more about. And in fact, as I say, Freedom Speak Up particularly is something we'll be talking about at our July board. So you'll see, if you observe the board or watch it back, Beth talking to us about her annual report to us, which is really important. So thank you so much. It's been some really good questions and comments from colleagues. Really welcome everyone's contributions. Many of these things are things we will come back to, no doubt, again, because they're ongoing things that we'll be focused on, certainly as board members and as NEDs, continuously seeking assurance on these items. But thank Melanie and Tim for their presentation on that. And as I said already, this is a regular slot. We ask NEDs to take the lead on a particular topic so you can hear directly from them. And we will choose the next topic based on any ideas that you suggest to us. Or so if you think of anything that you'd really like to hear more about and you think others would, then please let us know, because we will then plan to cover that the next time round in a similar way, to give you a chance to hear how NEDs get their assurance on these topics. So with that item, we have come to the end of our formal public meeting. I haven't got any other business that I particularly need to raise. We will circulate slides and any additional content that we shared with you today round to you. And if you've got any questions to follow up on, that would be absolutely fine, and we'll welcome those. What I would like to do is just remind governors, we have a private meeting starting shortly. What I'd suggest, we're a couple of minutes behind, but just to give you a break so that you're not leaping straight into that private meeting, we'll start at 5 o'clock, please. So there's a separate link for the private meeting and a separate set of papers. It's really important that governors don't run away, but come back for that private meeting, because there are some decisions that we need you to make. I hope we can get that business done fairly quickly, but I do need a quorate councillor governors to make some decisions in that private meeting. So if I can ask you to join us again in that link at 5 o'clock, it'll just be myself. I think Melanie will need to join, won't she, or will she? Melanie's not joining that one. No, we're doing doing that separately. I wasn't sure whether we needed to get Melanie in. Sorry, but I think Richard and his team will be part of that as well. So we'll see you shortly. But thank you, everyone, and thank you to other colleagues who were involved today.
Thanks, Krishni.
Thank you.
Thank you.
Bye-bye, everyone.
Thank you.
Bye-bye, everyone. Bye-bye.
Thanks.